University of Idaho Extension prioritizes an understanding of local communities, a high value on science and research, and a development of resources that improve Idahoans' quality of life. Matters of health have always been deeply connected to the mission of Extension.
The mission of University of Idaho Extension is to improve the lives of the communities that the Extension educator serves. Extension is a valuable health resource for Idaho, building a thriving, prosperous, and healthy Idaho through great partnerships and communities.
University of Idaho Extension has always been connected to health in the work that we do. On a national level, all extension programs have been asked to really be looking deeper into the barriers that our communities experience and actually do something about that to help decrease or eliminate those barriers.
Extension implements programming in areas of chronic disease prevention, nutrition insecurity and food access, financial well-being, and mental health. Developing new partnerships with our local public health districts have led to expanding those programs to include things like immunization education and the establishment of multiple community health coalitions.
We've been able to work with the University of Idaho Extension for the last several years. I think most notably that's been with their involvement in our community health action teams. The resources that are available through Extension, being able to increase the awareness around those resources in the community, but then also being able to look at what are the opportunities that we have to collaborate together to increase our capacity, to increase our reach, and ultimately to increase the impact that we have on the community.
Our projects with the Extension Collaborative on Immunization Teaching and Engagement, or EXCITE, have expanded our role and visibility as a trusted messenger. As educators who, for over a century, have been dedicated to sharing reliable, evidence-based resources, we were able to meet the need, particularly within groups of Idahoans who are disproportionately impacted by the spread of disease.
It's well known that ag is it's the economic lifeblood of our area, and we can't afford to have our ag workers all out sick at the same time or have disease outbreaks among our ag workers. It would be very harmful to our economy. I know the dairies that we've worked with, that's the owners and their managers, that's their thought. Like, they don't want entire groups of people being sick at the same time. We had some dairy owners and managers reach out to us after the COVID vaccine was released and say, hey, we want to vaccinate our employees, we want to offer them vaccines. So we had just barely started breaking into that population, and at that time we saw it as an opportunity to vaccinate thousands of ag workers who probably had never been vaccinated, and some of them for anything. In our area, the University of Idaho Extension is a trusted partner, especially among our ag industry. And so it's always great to have that when you go in to talk to somebody that they trust, somebody that they know.
Any efforts by Extension wouldn't be complete without youth-adult partnerships. Recent collaborations with our 4-H health advocates have led to 2 young women learning about nutrition insecurity among their peers and working to find creative solutions.
The thing we wanted to focus on was athletes and nutrition. We know that a lot of students at our school don't come from families that have the same resources, so we wanted to make sure that those athletes who are using a lot more energy and fuel throughout the day get that nutrition that they need, especially if they come from a family who doesn't have as many resources as some others might. And so that's what we've been doing. We created snack bags with food access cards, nutrition facts, and then reusable water bottles as well.
So this experience has really changed my perspective on how I can change our community for the better. I didn't think that as a teenager I was going to be able to make change in my community. I just thought that teenager is kind of something that you do when you're older, right? So it's just all around like inspiring and how to make a change, how to do the process.
Our hope is to support youth and adults in growing their understanding of not only what directly impacts their own health, but the factors that impact the health of their communities, helping our neighbors access what they need to be their healthiest selves.
Where we're growing, I think, is going upstream and providing resources, support, and training for our community health partners so that they can then create systems level change, that they can have that ripple forward in all of the people that they're serving. And so our impact only grows and it just gets wider and wider.